Hello, and thank you all for joining us today for the learning event on building an interdisciplinary care team for the Malnutrition Quality Improvement Initiative Learning Collaborative. We're glad to have you listening. I'm Kelsey Jones. I lead much of the MQii Learning Collaborative project and will be sharing some insights today to help you think about who you may want to engage on your Learning Collaborative project team, how to engage those individuals, and kind of some best practices and recommendations to make this a really effective and interactive partnership. So after today's presentation, you'll understand why the interdisciplinary care team is important when planning and implementing your quality improvement project. You'll be able to engage and build a successful team, taking into account the needs of your individual organization, your resources, your staffing capabilities, and then thinking about how to maintain engagement throughout your quality improvement implementation. And then finally, we'll talk about briefly the benefits of reaching out to your quality improvement department early. So who should be on the team? We really strongly recommend building an interdisciplinary team. I think we find that to the extent that you can have individuals from a number of different clinical groups, some champions at the senior leadership level, et cetera, supporting your effort, you'll be more successful. That said, take this within the context of your individual institution. So if you all do not have the staffing or the ability to do a large kind of multi-clinician initiative right now, focus on engaging a small team of dietitians or a small team of nurses. And then as the initiative grows, as it gains more visibility, perhaps you'll be able to expand it. To that end, if you're able, we recommend kind of establishing a project team. This is the group that will help you kind of support the day-to-day activities of the initiative, determining, what quality improvement area of focus you want to target, be it screenings or assessment rates or diagnosis rates. They'll help you kind of engage with other clinician groups and share the fact that you're doing this initiative and what you're focusing on and why you're doing it, some of that rationale. And they'll just be the ones really kind of shepherding the project along. Obviously, your care team is the group of clinicians that you'll be working with to actually implement the changes. So if you're focused on nutrition screening rates, then you probably will need, at a minimum, nurses and dietitians kind of engaged to help think about how do we get those screening rates up. And they're going to be the ones on the day-to-day basis kind of undertaking the activities necessary in order to meet your end goal. So you can see on the project team, we have, everything from project managers to different types of champions across clinician groups, informatics or IT reps. And then on the care team side, you may have dietitians, physicians, pharmacists, nurses, speech pathologists. It just kind of depends on the specific intervention that you all are focusing on. We do have a resource online that I would encourage you to look at, the Project Teams and Workflow Mapping presentation, to help guide you in identifying your team and figuring out how best to engage them. So now we're going to have Jill Johnston from West Virginia University Hospital speak to us a little bit about what they did at their facility and some recommendations on how to build your team. So hi, Jill. Thank you for joining us today. We are excited to hear more about how you engaged your team to support this project at West Virginia University. And just to begin, one thing I may not have mentioned up front is that you all have been participating in the MQii Learning Collaborative for 2 years. So can you tell us a little bit about your involvement and what you all did at WVU?
We, again, participated in the first part of the Malnutrition Quality Improvement Initiative last year, and we felt we had identified some areas that we really needed to improve upon, and we're happy to participate in the second part of the initiative. So in the first part of the initiative, we were focusing on our timeliness of screening and trying to get nutrition support within 24 hours and looking at our care, continuity of care upon discharge. And back in 2006, we had already obtained nutrition order writing privileges. In 2010, we had a malnutrition documentation program. So we felt like we had met some of the criteria that were already there. We had been very successful at our malnutrition documentation program. At the time, we actually won a quality award from the hospital for our work on that project. and then further evaluated that in 2014, and the hospital paid for us to get additional nutrition-focused physical assessment training. So in the first part of the initiative, we did not have an oral nutrition supplement order, but we did have nutrition, again, order writing privileges. We did not have a validated screening tool at the time. It was something that I had been working on for years but had not been able to get it into our electronic health record. We were bringing some other hospitals on board with us, and a lot of changes and projects that I wasn't able to get it implemented. So that's kind of in a nutshell the two parts of our initiative. What we found before and after we started the program was that out of 1,359 patients admitted, for those of 65 and older, only 9.64% of those patients triggered. We always thought we had done a good job with our nursing triggers and identifying those patients, but knowing statistically, and research showing that 30 to 50% of patients coming into the hospital over 65 can already come in malnourished, we knew we had a long way to go there. In addition, only 27 of those patients ended up with a malnutrition diagnosis, which only equaled less than 2% of the total admissions. So we knew we had a long way to go in our process. We needed to make sure that we really worked on those two areas.
That's great. I mean, it's fascinating to see where you felt you were performing well, but the data was suggesting otherwise. So once you knew this was a project you needed to do and you had identified some of the changes you wanted to make, how did you start to build that team to support this project?
We were lucky that our physician champion during the first part of that initiative, he's currently the COO of our hospital, but back in 2010, he was a staff physician and was one of our physician champions from our malnutrition documentation program. So he was very supportive of this project and was our physician champion the first time around. So that's one of the things that I would say we really learned is you really have to get the right people involved in your team. You need to get a physician champion that's really supportive of nutrition, getting your quality improvement department involved, getting your IT involved so they can really understand, what you need out of the process.
It sounds like you had a really strong supporter in that physician champion, which is fabulous. As you heard earlier in the presentation, we strongly recommend engaging a physician champion. Obviously, it's not required if you don't have one that fits that role, but it can be very helpful in moving the project forward as you discussed. So, Jill, once you had that individual on board, how did you get other clinicians on board and bought into this idea?
So after going through multiple committees and multiple barriers, I was finally able to, with this data and with the push of our physician champions, really convince our committee that kind of just make decisions about our electronic health record that we really needed a validated nutrition screening tool, that we were missing so many of these patients in this population, and realizing from our malnutrition documentation program that when you identify these patients, it's not only additional reimbursement to the hospital, it helps the overall risk adjustment, it helps prevent, obviously, as everybody knows, the bounce back readmissions, decreased length of stay, pressure ulcer risk, fall risk. So it really affected every single team member in the hospital. And so we really wanted to focus on this is how many people we're really missing. So the first part of the initiative really was eye-opening to really help us focus toward where we wanted to move from there. And, we participated and we thought, well, this will be really good and really interesting because we're going this direction. But once we found out these results, it really spurred us forward to really want to continue this process.
That's great. So why is it important to engage a multidisciplinary team? One, it facilitates appropriate malnutrition-related patient care from admission to discharge. It ensures that at every step of the process, no matter which clinician is touching that patient, they are getting the optimal nutrition care. Second is that it promotes important engagement by care providers across all stages of the workflow. So, if nurses are responsible for screening, then you've got to get nurses engaged. If physicians are involved in the diagnosis at your facility, then they are engaged. And then finally, it includes the patient and the family caregivers in efforts to address gaps in the hospital's malnutrition, including tailoring activities to that patient preferences and experiences. A lot of our organizations that have participated in the past do this by engaging the Patient and Family Advisory Council, which is a way to perhaps identify some patient advocates to work with, kind of vet some ideas about how to make this a patient-centered and patient-focused initiative, and really ensure that the output has the kind of buy-in from the patients so that even beyond the hospital, they'll be kind of continuing that appropriate nutrition care, that the care that they're receiving reflects their preferences, et cetera. As you know, the MQii spans every aspect of the malnutrition care workflow. We support hospitals who choose to focus on kind of any step in this process, from screening through assessment, diagnosis, care plan development, intervention implementation, and then monitoring and evaluation and discharge planning. And just to give you a sense of the different types of individuals that may be involved in each step of the process, you can see along the bottom here, at a minimum, typically a nurse, a dietitian, and a physician is critical in ensuring this kind of appropriate process for that patient. As I mentioned earlier, if you're focusing on one specific area and you're more limited in staff and resources, you may not need to engage each of these different groups, but as you build your initiative and think about expanding to different areas, this will give you a sense of some of the, at a minimum, clinicians that are involved in each step of the process. And then again, you see the patient and caregiver going across the entire thing, because the intervention really won't be successful if they're not kind of understanding why malnutrition matters to them, what their nutritional status is, and what they need to be doing in order to help address it as well. A few tips for successful team collaboration include understanding that the culture of quality improvement is local even to specific units and teams. So you need to think about what are the individual needs of the teams that you're working with. Certain departments or units within your facility may have different goals, and it'll be important to really align your messaging with the goals of those individuals. Help them understand how the benefits of your quality improvement project are going to benefit them as well. Maybe it means fewer patients with pressure wounds, so less work needed to address those patients' needs. Perhaps it means fewer infection rates, so you may have better surgical outcomes. Just kind of having those conversations with your specific teams and units and making it relevant to them is going to be really critical. Second is including staff members who have different levels of experience and roles, even some who may be outside the traditional care team. I mean, I think the patient kind of falls into that area, but having individuals that, both are more junior and have a lot of fresh ideas, as well as those who have a lot of experience doing quality improvement or engaging with leadership or leading IT efforts, if you're collecting data on this initiative, will really help you support and effort and energy necessary to move this initiative forward. This third piece is critical, and it's really around having clear goals, outlining what you're trying to achieve, and then building your plan around how to do so and conveying that to the members of your project team, kind of having regular milestones and checking in along the way to see how progress is going. If you can collect data throughout the process, think about, is the data showing that you all are seeing improvements and changes as you expected, et cetera. That will help you kind of keep your eye on the ultimate output that you're trying to achieve and move towards it in a way that aligns the entire team around that goal. And then finally, once you have that project team established, you have your champions in place, you have a plan for implementing this project, we strongly recommend that you meet as regularly as possible and establish clear communication mechanisms, whether it's a distribution list in your hospital's email, or regular updates via email, or mini newsletters, or team meetings at a regular time, maybe weekly or every other week, just to check in, see how things are going, discuss any barriers that you might be encountering, and think about ways to overcome challenges as well as capitalize upon the opportunities that you all are already achieving. If you see some changes in your performance, if you see better patient engagement, maybe there's opportunities to share that via hospital-wide newsletters or unit or department-specific updates. Think about those opportunities as well. Jill, so what benefits have your clinicians seen from this? If you were to give advice to other hospitals trying to recruit clinicians to support this effort, what benefits do you think they should convey to, other dietitians or physicians or nurses in their hospital to help them see the importance of malnutrition care and the need to support quality improvement on this topic?
You know, my assistant VP and my director are appreciative of, you know, all the work that we've continued to do, that, again, it's being reflected in, you know, seeing additional malnutrition documentation and diagnosis, speaking with nursing, educating nursing, because a lot of times, you know, nurses know nutrition, but I think you really have to get down to their level to let them understand, listen, if you have a patient that develops a wound while they're here, we're not going to get reimbursement. And when you think of how much more time and effort you're going to have to spend on caring for that wound, or if there is fall risk, or, you know, documenting their intake, it's a lot more time and energy on you. So I think it's kind of brought team members closer together and understanding that nutrition is just as important to them as it is to us, and that understanding that their part of the puzzle is just as important as everybody else. And administration, you know, talking to them that this is a national quality initiative. You know, I've been working on this for a long time, but you've got, you know, your national academy that's looking into this, that this is an impetus, and it's going forward with these electronic quality measures being submitted to CMS, that this is going to impact, you know, everything, that their eyes and ears perk open when they see the data and the black and white, and you kind of have to get with that with the senior leadership so that they have a better understanding.
Well, that is so helpful, Jill. I love the way you framed up how you made it relevant and applicable to the nurses, dietitians, et cetera, to show them how doing this will impact their day-to-day work and benefit the hospital overall. So quickly, what makes a successful project team members? I think identifying strong project team members, as I discussed before, is really going to help you ensure the greatest success for your project. So at a minimum, you know, you need someone who is a leader, who is recognized by their peers as being a leader or a champion, and has a lot of respect and kind of just general ability to move things forward. Someone who's dedicated to the project, is willing to put in the time and effort to help move this forward, and kind of believes in what you're doing. And that, again, speaks also to this topic of passionate. They get why you're doing it. They get why malnutrition care is important. They get how malnutrition impacts patients, and they're able to help communicate that to others, and really want to commit to moving this forward. And then finally, has a demonstrated interest and ability to drive innovation at the hospital, sees the need for change, and is able to support that and, you know, help build that team to help you move this effort forward as well. So I want to talk briefly through some of the roles and responsibilities that you may want to have on your team. One is an executive sponsor. This is typically someone at the hospital leadership level to help champion the effort, works to maintain executive leadership buy-in. If you can have someone like a CMO or a chief quality officer involved, that's really helpful, and it just helps kind of get the facility engaged and excited about the initiative. Next is your project champion or lead. This is typically the individual who helps support the day-to-day efforts for this initiative. They may be the one that kind of identified it for the facility, and is the individual who will help determine what the project looks like, engage with the project and care team, you know, think about the strategy for rolling out the change, be it changes to the EHR or education and training, and just really builds enthusiasm across the hospital for the project. Third is the IT developer or reporting analyst. This individual will help you with data extraction to see if you are changing in terms of clinical performance over time, for example, if your screening rates are going up or if the rate of appropriate diagnosis is going up. They may also help you collect data on other indicators that you may want to look at. So if, you know, your hospital really has a goal of reducing infection rates, they may be able to pull some data on that for you. And whether or not you are, you know, doing formal data collection with the MQii team on our end, or you're doing it just kind of internally to understand, trying to kind of have that IT relationship to be able to pull that data on a regular basis will really help you see that change and help convey any benefits that you see to others within the hospital, to kind of show those hard numbers about how your performance is changing or your outcomes are changing. Next, we strongly recommend having a champion across each of the clinical groups that you are engaging. So even if you engage groups beyond what's listed here, you may want a pharmacist champion in addition to dietitian, nurse, and physician champions. But these are really individuals who will help secure buy-in and support and engagement from the care team members who are going to be carrying out these activities on a daily basis. So if you're trying to get diagnosis rates up in your hospital, and you need the physicians to support that, to understand their role in documenting and signing off on malnutrition diagnoses and things like that, then the physician champion is someone who can advocate for that among physicians and help them understand what they need to be doing, why this is important, how it affects patients' outcomes, et cetera. Similarly, the nurse champion may help if you're doing a screening or if they play a role in discharge planning and even just carrying out the interventions. And then obviously the dietitian champion is a critical role to help you just ensure that appropriate nutrition care is being carried out throughout the patient's experience in the hospital. One thing to note is that your project manager may be the same as one of these champions, just kind of depending on how you structure your team.
The physician champion that we had this second time is an ICU intensivist, and he was our big push to help us get this validated screening tool. He was on the call with the team that made the decisions and really was the one to say, I don't understand why we're not doing this. We have to understand how important malnutrition is to every aspect of care, and that we have to identify these patients, and it just affects everything. And he was pretty much a no excuses kind of person, so he was the perfect person to have as my physician champion. Again, I had, good support from our IT and quality department, but it takes having somebody passionate enough to really be on the team to help you move forward with this.
We also strongly recommend building a sustainability team. This is really a team of individuals that is designated by the project champion and will help just ensure and maintain that the project continues beyond, your limited implementation period. So even after you stop doing designated training and education on your topic, or you stop building the tools into EHR, whatever your intervention may be, this team will help ensure that the change is kind of sustained within your hospital and that you continue to see the benefits from that effort. And then finally, as I spoke to earlier, engaging that patient advocate or patient representative will be really helpful in thinking about patient preferences and tailoring your initiative to the needs of your individual patient population. So a few quick tips on how to recruit project team members. We recommend that you reach out to colleagues that you may already know or who have experience working on quality improvement projects. And similarly, you can talk to your quality department, see if they can support you or if they can recommend other clinician leaders who have previously worked on quality improvement efforts. When you're thinking about recruiting individuals, you also want to think about that value proposition. How does this matter to them? So you can share statistics about the prevalence, burden, and impact of malnutrition to the hospitalized patient. We actually recommend that if you can and if you have that data relationship, try to pull specific statistics for your hospital, looking at what rates of readmissions, length of stay, pressure ulcers, infection rates, et cetera, look like between malnourished patients and non-malnourished patients. And that may provide you with some really nice data to take to leadership and other clinicians and say, you can actually see how malnutrition affects the outcomes of some of these patients. You can also link opportunities associated with the MQii Learning Collaborative to institutional goals, priorities, and metrics, as I mentioned. If you are trying to get down your readmission rate, kind of share how better malnutrition care can support that. And then finally, convey that, there's an opportunity to raise the visibility not only of that member of the team, but also the hospital and their leadership in doing this by presenting and publishing on results as you have them. And that's something that we also will help you with throughout the year, is thinking about those presentation and publication opportunities as you achieve the progress of your project. Finally, a great way to talk to and engage the team members is to attend team meetings. If there's dietitian huddles, if there's nurse huddles, kind of go and talk to them about why malnutrition matters and why they should become engaged. And then you'll see on the MQii website, we do have stakeholder letters to help you conduct outreach to these different clinician groups and convey why this is important. So once you have engaged and identified your team, it will be important to keep them engaged throughout the duration of the initiative. We recommend that you identify clear roles and responsibilities for each individual to help them know what they should be doing and what their role is on the team. Schedule standing team meetings to reconvene, but also recognize that there may be other mechanisms of communication that work best, and be flexible in that communication approach. Utilize email and ad hoc meetings as needed to keep them updated and engaged. And then finally, solicit feedback from team members early and often. Understand, what barriers they're encountering, what's working, what's not, so that you can be addressing those challenges and keeping the project moving forward. And we do offer a sample meeting agenda online that you can use to kind of help think about some of the topics you may want to cover and to organize your meetings with the team. Finally, as I mentioned earlier, there's no one right team composition or exact fit that works across the board. You should tailor this to the needs of your individual organization. And this is two quick snapshots. These are both large urban medical centers, but they had very different teams. The one on the left you can see was really focused on supporting training and education, and they wanted to engage, for that reason, their nursing department and their dietitian department in effectively carrying out care practices in a way that was better aligned with what's in the guidelines and guidance. On the right-hand side, you can see this team was a little more focused on some of those IT interventions and addressing some of the barriers that they were encountering through changes to their EHR. And so they did so by working closely with IT and then engaging physician champions so they knew how to appropriately document things. Like I said, build the team to fit your available staff, your available resources, and the particular needs of your organization. And finally, I just wanted to mention to the MQii Learning Collaborative participants that we do have a number of resources online. I mentioned a number of these throughout the presentation. We will be sending a follow-up copy of these slides, so you can follow the links listed here to access these resources and use these as you go out and try to engage different team members in this project. Should you have any questions, please feel free to reach out to a member of the MQii team. You can contact us at malnutritionquality@avalier.com, and we're happy to chat with you as needed about any other recommendations for building and engaging that team to make this a really successful initiative at your hospital. Thank you for joining us today, and we look forward to continuing to work with you this year.